If you're ready to stop feeling like shit and start living your best life, then this podcast is for you. Tune in as Dr. Buzz and Daniela provide guidance, education, and the tools you need to make a positive and lasting change. Doctor of Chiropractic Medicine, Regenerative Medicine, and Functional Wellness, Dr. Buzz has 24 years of experience changing people's lives. Daniela has first-handedly taken back control of her health, and together, these dynamic hosts have unique perspectives and expert advice. Get ready to transform your mindset, take charge of your well-being, and discover the key to changing your life forever. Welcome to Stop Feeling Like Shit, where the power to change is in your hands.
Welcome back to the show, Stop Feeling Like Shit. And on today's episode, we're going to be talking about who should not be taking ibuprofen. So, Dr. Buzz is with us. And Dr. Buzz, go over what is ibuprofen and tell us a little bit about who should not be taking that and who should be taking it, if anyone.
Okay, yeah, so I think what I want to call it is really NSAIDs, which are non-steroidal anti-inflammatory drugs, which ibuprofen does fall in that category, but you also have Aleve, Motrin, naproxen sodium. Those all fall into the category of NSAIDs, and they all work on the exact same way, okay? And basically what they do is they block these things called prostaglandins. And there's many different prostaglandins, and some of those prostaglandins cause inflammation, and inflammation is what causes pain. Okay. So, but what's important to understand is there are good prostaglandins too, and you need some prostaglandins for the healing process. So these NSAIDs, so just to be clear, NSAIDs are, Advil, Aleve, Motrin, naproxen sodium. Those are what fall under that category of NSAIDs. Tylenol is not an NSAID, and aspirin, it's kind of an NSAID, but they don't categorize it that way, so we're going to keep that out of that category, but we're talking about these here. People take these way too much, and they were really designed, if you read the bottle, and I think what confuses people is you can go to Costco and you can buy a bottle of 1,000 of them for, and they're very inexpensive. So I think people assume, well, it's over the counter and you can buy 1,000 at a time, so you probably can just take every day. It's not that big a deal like a vitamin, right?
Yeah, and typically people are taking these for headaches, maybe their back hurts, or I don't know.
Yeah, any type of pain.
Yeah.
And once again, when taken properly, they're very good. You know what I'm saying? Like, I had some dental work done, and ibuprofen work great, but they're for short-term use only. That's what they're designed for. They're not designed for long-term use. So, if you want to take it for 2, 3, 4 days, maybe even a week, it's fine. It's when people are taking them on a daily basis that there's lots of different bad health effects, and that's what I'm really going to focus on today. So once again, we're not anti-medication, but you have to take medication properly.
Right.
And just because something's over the counter, it's not a prescription, doesn't mean you can take it every single day.
Right. So if you're listening to today's show, if you're taking ibuprofen every single day or one of the NSAIDs,
or every week, maybe
yeah.
I take it 2-3 days a week. That's still bad. Like,
Yeah,
once again,
still
it's
too
designed
much.
for very short periods of time.
Yeah, then this is the show for you.
Yeah.
All right.
But we back to what had happened. So basically, it blocks these things called prostaglandins, which cause inflammation. But you also have good prostaglandins, like you have prostaglandin PGE2, and that prostaglandin is a good prostaglandin that gets blocked when you're taking these. And that prostaglandin PGE2 is needed for stem cells to do their job. So we all know stem cells is how your body heals, but if you're taking these NSAIDs, your own stem cells can't heal you. So it inhibits the healing process. And like with all of our regenerative medicine patients, whether we're doing PRP, A2M, allografts, they can't be taking NSAIDs because tissue won't grow back if you're taking NSAIDs. So think about this. So a lot of people take, these NSAIDs for arthritis pain, but if it inhibits stem cells from growing new cartilage, you're actually speeding up the arthritic process. Do you see what I'm saying? So it's actually making you worse, not better. So, if you have a headache, you can take an Advil, that's fine. And if you have dental work or some type of short-term pain, even for a week, that's fine. But you can't take NSAIDs every single week.
Right.
Just because it's going to speed up the arthritic process. And there's lots of other things that happen too. It can cause kidney damage. That's very well documented. And basically what happens is kind of interesting what it does with your kidneys. Is with your kidneys you have what they call afferent blood flow that goes into the kidney. and then the kidney is filtering things, and you have the efferent going out. But when you take these NSAIDs, what happens is it dilates for some reason the afferent. It makes the blood vessels bigger going into the kidney.
Mm-hmm.
So the problem is then that overloads the kidney and causes kidney damage.
Wow.
Once again, if you're taking long term, not
Right.
short term. So, and then, in kidney damage and dialysis is pandemic in our society. Millions of people are on dialysis. A lot of those people get that way because they were taking NSAIDs for pain.
Yeah.
So it can cause kidney damage. It increases your chance of having a stroke. It increases clotting, which is bad. No one wants to have a stroke. There's no good strokes, right?
Right.
It can lead to heart damage.
Mm-hmm.
And these are all things that are very well documented that are on the label.
Right.
And once again, I think it gets minimized because this is, an over-the-counter, not a prescription. If it was that dangerous, why can't I go buy 1,000 of them for $30 at Costco? But you got to read the label and understand that these things were designed for short-term use only.
Right.
Very important. And I think the bigger picture too is, I always tell people, what causes pain. Whether it's pain in your knee, elbow, shoulder, back, wherever. Well, pain is a warning. Your body's telling you, there's something wrong. Okay.
Mm-hmm.
And what happens when there's something wrong is kind of like a check engine light. Your body releases these other proteins called cytokines that are like a warning that says, if it's your back, we'll say, for example, you do something to your back, there's some type of structural issue, your body would release these cytokines to warn you, don't use your back, which cause pain. So the pain is telling you what you should and shouldn't be doing.
Mm-hmm.
So if you have back pain, you're like, well, heck, I'm just going to take some ibuprofen. It's like putting, if your check engine light comes in your car, would you put duct tape over the check engine light and keep driving the car?
No.
But that's what you're doing when you're taking a pain medication.
Right.
Now, once again, short term, that's okay,
Mm-hmm.
right? But if you're taking, if you have back pain, you're taking ibuprofen every week or these NSAIDs every week, number one, you're causing more damage. It's like if your check oil light on your car, you need to add oil to it, you need to fix it, and you just, put tape over it and running the hell out of it.
Right.
That's what you're doing to your body. You're speeding up the degenerative process. Remember, we talked about too, when you're taking those NSAIDs, you're also inhibiting your own stem cells from healing things.
Mm-hmm.
So you need some of these prostaglandins. So not only are you causing more damage because you're doing things you probably shouldn't be doing, but you're also inhibiting your own stem cells from getting the body to heal.
Right. And when we're taking these things too, I assume that it's causing some sort of damage or to our liver if we're taking it every week.
Yeah, it's toxic. It causes kidney damage, liver damage. People with asthma, it does the same thing with the bronchioles. It can cause bronchial spasms.
Mm-hmm.
I mean, they're with any I always tell people anything that's not natural to the body, which obviously an NSAID, you weren't born with NSAIDs. Anything you take that is synthetic to the body always has repercussions.
Yeah.
Now, I'm not saying never take them,
Right.
but just realize that if you're doing something not natural, there's always a negative associated with it.
Mm-hmm.
So limit your time.
Right. And so also what you're saying is that if you have this chronic pain or pain where you have to take these things every single week, I know at Buckeye, people can come in. It's like if your back hurts or your knee hurts or your hands or elbow or whatever it is, they can figure out the root cause of this pain, and you may need MRIs or x-rays, but you guys can figure it out. And so with that being said, they can kind of do a 180 with this whole thing with treatment.
What we do at Buckeye is, find what's the root cause.
Mm-hmm.
Unfortunately, the way medicine is these days, the average doctor visit is 6 minutes in
Right.
the U.S. There's no way in 6 minutes someone's going to be able to diagnose why your back hurts. It's just
Right.
impossible. The back's very complex.
Mm-hmm.
Or why your knee hurts. So when you come to Buckeye, a typical visit's 30 to 45 minutes where we're going to sit down with you and figure out what the root cause is. And if we can help you, we'll let you know.
Mm-hmm.
And if we can't, we'll refer you to someone who can.
Yeah.
But if you never get to the root cause and you go to your doctor and they just say, typical medicine, you go to the doctor, hey, my knee hurts. Okay, take some, here's a prescription ibuprofen.
Right.
If that doesn't work, come back and we'll go to the next step. That's not fixing anything. Your knee hurts for a reason. It's not normal to have knee pain or back pain or whatever that is.
Right. So it's not normal to be in pain.
Right. It may be common,
Yeah.
but it's not normal. Just like, in the winter, it's common for people to have the flu, but it's never normal to have
Right.
the flu.
And I hear this thing all the time. It's where I'm getting old. That's just this part of way. It's like getting old. I'm getting old. So, I'm getting old and I have pain. That's just what life is about. And that's not true.
Yeah, your joints are designed to last over 100 years. There's lots of people we have that are, my mom, she's moving great, right? Like
Yeah.
you don't have, your joints don't wear out. It's kind of like a car. As you get older, you potentially need more maintenance.
Right.
Like we have a 67 Camaro, like, that requires more maintenance, but that car runs better than most new cars on the road, but there's a little more maintenance involved with it.
Mm-hmm.
But your body's the same way. Your body, there's no reason you can't be in great shape well into your 90s or even into your 100. Your joints don't wear out.
Right.
And it drives me crazy. Well, people come to the office in their 50s with knee arthritis, and they're kind of. My doctor said eventually I have to replace my knee. No, you don't have to replace your knee. You can save it a lot of times if you don't wait too long.
You hear that? For
Yeah.
all of our listeners, if you, your family, your friends, if you're struggling with arthritis, I'm telling you, Buckeye is the place to come. And the reason why is because they have things to help you. So I want listeners to really dial in and think of people that are struggling with knee pain. You do not have to get a knee replacement. I know some people are on that train, but it's hard for people to understand this root cause thing sometimes, and because of traditional medicine,
Yeah.
So let's go back to that. So they come into the office and they figure out what's going on, and they come up with these treatment plans to fix these people. It's a game changer.
Yeah. And just to be clear, you know, obviously we can't help everyone, but you don't know if you
Right.
don't come.
Exactly.
You know what I'm saying? In a Buckeye, if we only accept patients we know we can help. So we can't help you. We're going to let you know, hey, you waited too long. Sorry, you're going to have to have surgery. But I'll tell you this, every single week we have people come here that is, I know you can't help me. My doctor said I have to for sure replace this or replace that or have surgery. The majority of our patients we help have been told that surgery is the only option.
Mm-hmm.
So just because a surgeon told you need surgery, you should get a second opinion
Right.
for someone who doesn't do surgery. And we refer to surgeons all the time. I'm not anti-surgery, but a surgeon's not the best person to tell you whether you're a good candidate for regenerative medicine or not. And what people have to understand is everything in your body is always rejuvenating and regenerating. If you're alive, if you're dead, we can't help you.
Right.
But if you're alive, and if you question that, if you broke your leg, would your leg heal? The answer is yes. If you cut your skin, would your skin heal? Yes. Your joints are the same way. Joints do heal. But if you're sitting there and you're listening to this podcast and you have, chronic shoulder pain, chronic knee pain, and they've told you have some type of degenerative condition, that simply means that knee or joint is breaking down quicker than it's healing.
Yep.
Regenerative medicine gives you ways to get that area healing again quicker than it's breaking down.
Yep.
And it works on every single person, every single time if it's not, as long as you don't wait too long.
Yeah. And I know a couple people that have called me and they're like, you're in the health and wellness space, and I know what your husband does. And so I want to talk to you about my knee. And I'm like, okay, great. And they'll start asking me questions. And one of the things that I get all the time is, well, let me go ask my doctor or surgeon about that. And I'm like, okay. And then they'll come back to me and they're like, well, they've never heard that before. Well, I mean, sometimes we don't hear about certain things. I mean,
Yeah.
it's kind of like we're in a different space, right? So
It's
maybe,
totally different.
yeah,
The analogy I like to use is like, if you need dental work, I'm not the guy to ask about it. I
right,
don't know anything about dentistry. If you do need a joint replacement, I don't know what the best joint replacement is. I don't know.
Right.
In the same way, a surgeon doesn't know the best way to do regenerative medicine
correct,
or know how to do dentistry. So that, we all specialize in different things.
right,
So if you have chronic pain somewhere and you don't want to do surgery, then you should see a regenerative medicine specialist, and only they can tell you whether or not you're a candidate.
yep,
And as I said, if we can't help you, we're going to let you know, hey, we can't help you.
right,
And that happens too.
yeah,
But just because your surgeon said you need surgery or a replacement person said you had a replacement, that doesn't mean anything. You really need to see someone who specializes it. We've been doing it at Buckeye for over 10 years. We've treated over 4,000 patients here. No one on the East Coast of the United States has done more regenerative medicine procedures than Dr. Bainan here at Buckeye. She's certified in stem cell therapy, bioidentical hormone replacement therapy. She knows what she's doing.
mm-hmm.
She's not going to accept you if she can't help you.
Right.
It's that
I
simple.
love that. Good.
So, but kind of going back to this whole thing here, the big thing I want to get across here with people today is, whatever pain medication you're taking, pain medication is fine short term.
Mm-hmm.
Pain medications are not designed to be taken past 7 to 10 days.
Right.
So if you're listening to this and you're taking any type of pain medication, NSAID, Tylenol, whatever, for a long term, you're not fixing anything. You're slowing down or stopping the healing process, and you're most likely causing kidney, heart, liver damage. You're damaging everything.
Yeah.
And that's why you see all these people with liver failure, kidney failure in the U.S. It's pandemic at this point. It's because the medications you're taking into your body that don't do anything anyways.
Yeah.
So very important. There are solutions out there for you, and it doesn't hurt to get a second opinion.
Yeah, I agree.
And no one should live in pain.
No, absolutely not.
And it's not part of the aging process.
No, definitely not.
Yeah, just because you're 40, 50, 60, 70, that doesn't mean that although it's common for people as they get older to have pain, it's not normal, and there's a big difference.
Yeah. So if you're listening to today's episode and you have pain, or you know somebody that has pain, give us a call at Buckeye. Come in and see us, and we'll help you.
Yeah, thanks so much.
Thank you.